Well, hello, everybody. I am here today with my good friend, Dr. Jeffrey Strawn. We're going to be talking about his talk at this year's NEI Congress. Jeff, how you doing?
I am doing well. How are you doing, Andy?
I'm great. Well, your talk is called Along for the Ride, Treatment Considerations for Childhood Psychiatric Disorders with Co-Occurring Anxiety. No one better to talk about this than you, my friend. Probably one of the countries, if not world's, experts on pediatric anxiety. And anxiety is common in our pediatric patients, both as a primary and a comorbid condition. And it's difficult enough to assess and treat by itself, but it can especially complicate the diagnosis and treatment when comorbid with other conditions. So, Jeff, in your talk, you're going to be exploring best practices for developing optimal treatment plans for pediatric patients with depression, bipolar, Tourette's, ADHD, substance use disorders, or brain injury with co-occurring anxiety. Boy, that's a mouthful, Jeff. Why should people come?
That is definitely a lot. So, one of the things that happens when we're treating patients with anxiety is that, as you alluded to, in and of itself, it can be difficult to treat. But oftentimes the approaches that we use when we're treating generalized or social or separation anxiety disorder become very different when we're treating those same anxiety disorders plus depression or plus ADHD. And that has a lot of implications, both in terms of the pharmacotherapy that we're using, the assessment that we're performing, and also in terms of our psychotherapeutic interventions for these kids.
Interesting. Yeah, and obviously the best outcomes are going to be combinations of these things. Jeff, I know you to be not only an excellent speaker, but someone who provides both theory as well as practical takeaways. So what
Thanks,
are some Sure. What are some practical things our audience can expect?
So one of the things that we're going to talk about is how to manage ADHD when it's co-occurring with anxiety.
Yeah.
And that certainly is a very common clinical scenario, at least in my practice. And I know from talking with colleagues and NEI Congress attendees over the years that they certainly encounter those same challenges. One of the things that we oftentimes don't think about is when we're treating that patient with ADHD and anxiety, and they're using a psychotherapeutic approach, we're often managing the ADHD with a stimulant. But the problem is, by the time that patient is actually getting into psychotherapy at 3 or 4 o'clock in the afternoon, that even extended release stimulant has essentially worn off. So now we're putting our colleagues who are performing the psychotherapy in a really difficult bind, in that they're relying on the patient to learn, to attend new information, to engage working memory, but they don't have that stimulant treatment on board. And that's pretty consistent with some findings that we see out of the child and adolescent multimodal anxiety study. And so we'll really spend some time talking about that and how we can optimize our treatment for both conditions to hopefully achieve better outcomes.
Yeah, I hadn't even thought of that. But, also I can imagine the rebound effect sometimes that happens when the stimulant wears off. You could see irritability or agitation or spaciness, as you mentioned. Boy, that's a great example. And I can also imagine the complications when I'm dealing with anxiety and, say, bipolar disorder or substance use.
And one of the interesting things that we're going to talk about when we look at bipolar disorder with co-occurring anxiety is, first, we know that having a co-occurring anxiety disorder decreases the likelihood of remission and response in adolescents with bipolar disorder following an initial mood episode. But the other thing that we're going to actually look at, because it's been included in some of the registration trials for newer medications, is the actual impact of a primary mood disorder treatment on co-occurring anxiety symptoms. And we actually see benefit there, including benefit relative to placebo. So we'll talk a little bit about that.
Yeah. Well, Jeff, you just made me realize that the top comorbidity with both ADHD and bipolar disorder is anxiety.
You're absolutely right.
So, and our treatments can complicate that. If you might be referring to atypical antipsychotics. I don't know the pediatric data as well as you do, but in the adult data for bipolar depression in particular, some of the atypicals have data that independent of the depression, they're also improving the anxiety.
And we certainly have some of those data now in pediatric samples, certainly not as much as we do in many of the adult studies, but we do have some data there.
Great. So, I guess we're going to be talking about these kind of tips with using a medication maybe to kill two birds with one stone, if you will, or to treat more than one thing, but also appropriate psychotherapeutic approaches and how to integrate those with our medication. So, boy, this sounds really practical, Jeff. It sounds like something that our audience is really going to get something out of. And, I'm sure knowing you, there'll be a little bit of humor in there, a little bit of fun as well.
You'll have to wait and see.
Okay. I'm curious to see which of your wonderful bow tie collection you might be wearing as well.
I haven't decided yet, but we'll see. It'll be a good one.
All right, great. Well, everyone, we really hope you will join us live at NEI at the Child and Adolescent Academy that we're having right before the start of our main Congress. So we hope to see you there in Colorado Springs in November of 2023.
Looking forward to it.